So it just goes to prove that it's able to be done. I was in Bow Desert for the official reopening of that service after 12 years only a few weeks ago, and I think I met baby number 2, 3 and 4. And since that time there's been a lot more babies, and we now have, I think, 400 women that are actually booked in to have their babies at that particular hospital over the next coming year. So that's quite extraordinary actually as well. And we're building those relationships with the midwives and building that particular workforce along the way. So we'll have a situation of where around about half of the women from that area who are pregnant will be birthing locally. And that's very, very important for them, and it's very, very important for their family. Later this year, we'll be reopening Cooktown. We do have the Townsville Hospital and Health Service, which are now looking at what they can do with regards to opening low-risk birthing services in Ingham. Again, that's another opportunity for women, and of course we'll be going from there. But what we needed to do was to prove to ourselves again, which you wouldn't think would be too hard. It's amazing how you lose confidence, isn't it? I mean, as technology improves and we become smarter, we become more reticent about our capability to be able to do things that we could do reasonably well generations ago. I really think that's quite strange, but nevertheless, it's sort of a groundhog day in the maternal context, but we've got there. So now that we've proven we can do it, we can go on and on and on from there. Similarly, the flying obstetrician and gynecological service is being enhanced and expanded to provide backup and support for women throughout Queensland as well, to make sure that they've got the highest quality of care in the birthing and gynecological context in their own local community. The Mums and Bubs service continues to be run out through Queensland, and we're finding a great degree of acceptance from women as they're now being engaged in the process of home visits at 2 and 4 weeks, and then of course follow up at a clinic at 2, 4, 6 or 8 months and then 12 months, and that's been embraced by women as well. That provides us with a great opportunity to make sure that women are engaged in that process, that we can assist those women with any of the challenges that they actually have, particularly the new mums, and maybe even other mums who are adding to their family as well, because whilst it's a time of great joy, it's also a time of great pressure, and everyone sort of understands that. I mean, it's a hugely significant obligation. I was talking to an expectant mum the other day at one of our local shows, and she just had entered, I think, the record 74 jams in the preserves and jam section. And anyway, she was heavily pregnant. She was looking forward to her first child, and how it wasn't going to interrupt her ability to be able to make as many jams. And I said, it's just quite amazing how everyone says that something 55 centimetres long and weighing around about 3.5 kilos doesn't change your life. Until you get there, it changes it significantly. So actually having that backup and support for mums is extremely important. And I understand around about, was it 5,000 to 6,000 of those additional services have been rolled out across Metro North. This is a very important health service, of course, within Queensland. The overall context, it has the largest budget, just over $2 billion, and we have about 9,000 women 9,000 babies that actually are birthed either in the Royal Brisbane Women's Hospital or in Redcliffe and Caboolture each year. So I understand that's the number. So it's quite a significant birthing area, district, and that in itself needs to make sure that we have the services which actually support women along the way. Where do we go from here? I have a very, very clear view, and I have a very, very clear vision about what we need to do to enhance maternal and perinatal services in Queensland. It's a matter of actually keeping the pressure on at a national level to make sure that our interstate colleagues who are committed to these particular processes continue to be on that journey, that we continue to ensure that we have more eligible private practicing midwives in Queensland accessing our public health facilities as well. That's extremely important where we're doing it. It's very, very well accepted by the mums, and it's about providing choices for those mothers as well. And I do understand that there have been areas where breaking those barriers has been somewhat challenging, but we've broken a lot more barriers here than any other place around the country where they haven't even decided to go to the barrier yet. So we've got great achievements, and again, look at the evidence. And again, there is no reason to fear it because it's what the mums want, and as part of a collaborative team it gives better outcomes for the mothers and their babies as well. And also making sure that we know exactly what's happening with regards to adverse outcomes for mums as well. We have a very small number, fortunately, but still too many women who pass away within 12 months of birthing in Queensland, and now it will be compulsory to register those maternal deaths so that we can actually get a better handle of the services that we are providing in Queensland as well, and making sure that those women can have the best possible outcomes, and that we can be changing our model of care and we can be changing our support to support those mums as well. The great work that Dr. Frances Hughes is doing within our Office of Nursing and Midwifery is also helping to support us as we go to these new models of care as well, so that we can actually map, we know what's going on, we can clearly give an indication of the benefits of it, and not only that, we've got cost benefits that actually come from providing greater options to mothers. Not only do we have better quality outcomes, but it is better value for money as well if you can provide that support and you're able to birth locally. Absolutely extraordinarily important, as I said. So we're going to continue to work through those things. We do still have a challenge with regards to what we're going to be doing with home birth, with regards to the professional indemnity insurance. You may have heard me say this before in smaller cohorts, but that can keeps being kicked down the road. I mean, at some stage we're going to have to say no longer are we able to kick that down the road, we're going to have to confront it in some way. We're looking at our options here in Queensland. It would be much greater and of much more significant benefit if it can actually have one single national approach, but we're a bit of ways from that. It's like one of these things where, you know, if you pull the pillow up over your head, hopefully the spooks will go away, like when you're a little child. It doesn't work like that, but there's a fair few people pulling pillows up over their head at the moment and hoping that it just doesn't need to be confronted. I mean, that's not really going to work. It's not going to work, you know, in the short to medium term. But from my perspective, we will continue to innovate in this area. We will continue to support. We will continue to encourage the active engagement of women in this process, of families in this process, because it is all about better options. Quality must always be the indicator, and if you use quality and evidence, you will get to exactly where we've got to today. And I've been absolutely amazed by some people who have been great cynics about the journey which we have been on, who have now become our greatest converts based on the evidence that we've been able to put forward about better outcomes with so many of the key indicators. So it's basically, for me, the train's set, it's going in a certain direction. We have no intention of actually taking a different track. We might have to obviously modify the speed along the way, hopefully a little bit quicker rather than slower, but we're hopefully going to be involved more and more, of course, with your respective organisations as we do this. But again, can I just say, it's fantastic that you've come together, that you've got this opportunity, and here within the Metro North Hospital and Health Service, to actually see them putting in place what is a newborns and maternity stream right across the system will provide, I think, greater opportunities for choices for women and their newborns, and far better outcomes for families. So well done, ladies and gentlemen, and thank you very much.